Alright, Frontline, it's Val. I'm back to do part 2 of side effect management. We left off at recognizing side effects. And so I want to say, before I go there, what we're really talking about here is symptoms, and these are the things that can be noticed. A bit later we'll do a sort of case study of one of the common symptoms, and it's important to realize that different diseases or different side effects can share the same symptoms, and so it's not always straightforward diagnosis of, oh, this side effect came from this. When do they start? When do side effects start? Well, like I said, some come on right away. Some side effects might not appear for several weeks. And knowing that they can come soon or come later can help you to figure out if the symptom that you have was caused by your medication. And an important question is, will they get better or worse? And some side effects start up at full strength, gradually get better, and disappear within a few weeks. Others can not be there for a while, come on gradually, and get more intense. So we do know that people who are starting medication when their CD4 count is very low often have more side effects because their body just has fewer resources for coping with the challenge of medications. So more on recognizing side effects. If you think that you're experiencing a side effect, it's important to contact your healthcare provider. You shouldn't stop or change doses of any medication without first consulting them. And if this is something that you've consulted them about and it hasn't gone away, it might be useful to keep a journal, particularly if it comes and goes at different times. Because that can help to provide some important clues for what's going on. More on this, because some side effects might not make you feel ill, such as, effects on the liver. This is the beginning stages of liver damage. It's important that people be monitored by their doctor with regular lab work. And we have one of the pieces of this class is lab work. And so if there's more that you need to know about that, then go ahead and find that or contact me. So that is to say, I'll say it more clearly because it doesn't have it on the slide here, but not all side effects have immediate symptoms. And sometimes, like increased cholesterol is a side effect of some medications, but it's not something you're going to feel necessarily. It's something that is identified through lab work. So here is a brief list of common side effects, and I'm not going to list all of them together. There are some that are particular to some systems and a handful that are about the body as a whole. And some of these might actually fit in one or two different places. And for any of these, if there's something that you really want to know more about, I highly recommend the AIDS InfoNet. AIDSinfonet.org has fact sheets on almost all of these side effects, and you can learn more in detail, more detail than I have time for here today. So again, if we were in person, I would have you list other side effects that you have experienced or heard about, and those blank bullet points. We're not going to worry about that right now. So one of the things I said earlier was finding solutions for medication side effects. And so here is a case study of nausea, which is an extremely common side effect from the meds. So it's defined as a general feeling of sickness or queasiness in the stomach. And we have here a handful of sort of possible treatments. So one, nausea can be controlled by switching the drug that causes it, but frequently nausea goes away by itself in a few weeks. It's one of those very common side effects in the adjustment period, and so often this diminishes on its own. There are drugs called antiemetics that are often effective in helping to control nausea. Another option is Marinol, which contains a synthetic version of THC, that's the active ingredient in marijuana. And so obviously that's not for everybody, but those are drugs that can help to, that you can take when you have nausea or when you know that it might come on. This says the drugs that relieve nausea might work better if you take them 30 to 45 minutes before taking the drugs that are causing the nausea. So other possible treatments, there are behavior change treatments that can happen. Eat small meals frequently instead of 2 or 3 large ones. Large amounts of food in the stomach may make nausea worse. Another of these behavior change treatments is to relax before meals and chew slowly rather than wolfing down your food, which is what I always do, to sort of take it really gently. There are some food preparation tips. Bland foods are easier to digest, so sticking to foods that are low in fat but high in starches and carbohydrates can fuel the body. And eating food cold rather than warm, because a lot of taste actually has to do with smell, and so food that's cold smells less, it radiates less, and so that can actually help you to get some food into your system, even if you're not feeling the greatest. More possible treatments for nausea, well, these are complementary therapy treatments. Fresh ginger root is good for digestion, and that says cut a small sliver and chew it before swallowing, best taken before a meal or before the meds if the meds give you nausea. You can also make tea out of it. Some people find that the medical use of marijuana relieves their nausea and helps their appetite. Obviously, not for everybody. Cut a lemon and smell the slices to lessen nausea. I've tried that. It's good. If the nausea is chronic, acupuncture can help. And sometimes nausea can be related to stress. So you might be interested in exploring some stress relief. Movies that don't have anything to do with your life can be really good. Massage, playing with pets or kids. There are a lot of stress relief options in the world. Sometimes hanging out on the internet. So thanks for hanging out on the internet with me. I will see you next time.